Good morning and welcome to another episode of Fertility Talk. Today we've got Sinopol. We've got Catherine from Sinopol, and Catherine's the brand manager at Sinopol, and she's actually new to the company. So welcome and thank you for joining us today, Catherine.
Thank you so much. I was very excited to hear that we're going to be talking about PCOS, some say PCOS,
Yes.
and just how do we help women to find that balance back. So thank you for welcoming me.
Thank you, thank you. So PCOS is definitely something that Sinopol shines in a sense of they know what they're talking about and they're quite clued up with PCOS. So we're going to just jump into our first question, Catherine. What is PCOS?
All right. So we're talking about a polycystic ovarian syndrome, right? It is a common condition that causes abnormalities in your hormones, right? It is affecting women that are at their reproductive stage. And just not there, it can go beyond later on in the stages or life.
Okay. Our second question is PCOS a commonly known disorder or condition?
All right. So just one thing that I just need to clarify for someone who's just new to the condition. The
Yes.
name itself, poly, means many. Then you're looking at cyst, which talks to being abnormal. So you've got these abnormal ovaries, and then syndrome means a group of symptoms, right?
Yeah.
Now, is it common to someone who's familiar with it? Let's say your mom has had it, you're a daughter, you have it. Yes, it will be common. Your friends have it. Yes, it is common. But if we look at statistics by the World Health Organization, we have globally up to 70% of women that suffer from this condition but undiagnosed.
Absolutely, absolutely. Thank you for that. Is there a specific age group that is affected with PCOS?
Yeah, so if you think about it, we're saying that it affects those that are at reproductive stage. So you're looking across different ages. You're looking at your adolescent, those that are menstruating, you're looking at adult female, you're also looking at the mature female as well.
Okay, perfect. Thank you. What are the symptoms associated with PCOS? So I think this is where it's going to help those that don't understand or don't know that they
Yeah.
actually have PCOS. So yeah, what is the symptoms associated with PCOS?
Yeah, I agree with you. Because if you look at these symptoms, look at the adolescent
Yes.
who's just having their menstruation, they're coming heavy, they are painful. That's a likely candidate. Those
Yeah.
who are struggling with irregular menstruation, it's also a candidate. Some of them will have struggle with obesity, acne, for example. You
Yes.
have these pimples that you're battling with. If you move to the female, the adult female, it gets even worse. Some people are struggling to fall pregnant, and it's because of PCOS. You're struggling with ovulation. There's also the endometrial cancer as well that you are at risk to have because of this condition. You're struggling with weight, you're struggling with ovulation. If you look at the more adult woman, again, you could be having insulin resistance. And
Yeah.
when you have that glucose gets stored into fat. It leads to so many things. You can end up with a gestational um, diabetes,
Yeah.
the diabetes you get when you're falling pregnant. Or you can have type 2 diabetes. You are
Yes.
at risk for from so many things, high cholesterol, the BP as well, which is abnormal, all of those things associated as with PCOS. So therefore, you need to see a doctor to be able to understand, am I a candidate? Could I be struggling with PCOS?
Yes. Thank you for that. When one suspects that they could be suffering with PCOS, who can they consult for help?
Definitely a healthcare professional so you can be properly diagnosed. Usually talk about differential diagnosis where a doctor will sit you down and
Yes.
say, let's see. They look at your medical history. If it runs in the family, they will pick it up. But there's also different tests. A doctor can look at your blood test, they can look at your physical examination. So it's not just one thing, they will look at different things to make sure that you are properly diagnosed.
Perfect. Thank you. What are the benefits of recommending Sinopol for PCOS?
Okay, so now we're talking Sinopol,
Yes.
which is a health supplement, right? It's classified as complementary medicine. It is a health supplement. This is a lovely product that comes with three active ingredients. It's a lovely formulation. It's got myoisotyl. It's got the alpha lipoic acid. It also has folic acid. A lot of people are usually familiar with folic acid, especially if you're trying to fall pregnant or you are pregnant, right? Now, this combination, the beautiful thing about it is it will address that hormonal imbalance, right? So you get back that balance of hormones, but also that alpha lipoic acid is beautiful because it's a fast, slow action product. That means the concentration of this product, you get it fast into the blood system to start working, but it also keeps it over 24 hours. So you're covered for the whole day, right? That folic acid, if you're trying to fall pregnant, is also going to help you in terms of conceiving. It also helps you with your red blood cells, meaning you've got your oxygen going around. So you've got a beautiful combination that can supplement whatever else your doctor is giving you.
Perfect. Thank you. What are the benefits of recommending Sinopol for insulin resistance?
So for those patients, remember we spoke about insulin resistance can lead to that glucose that is not controlled.
Yes.
And remember, glucose, it's supposed to give you energy when you break it down. If it's not stored properly, it's going to cause you a whole lot of problems. So you need to get it under check so you don't end up with diabetes.
Mm.
Having this supplement, it's going to make sure you balance these hormones. Then you reduce your resistance to insulin. Then your quality of life improves.
Thank you so much. Is there a cure for PCOS?
Oh, unfortunately not, but don't lose hope, right? The beautiful thing about us women, we are used to taking a pill here and there. So we know how to develop a routine, right?
Yes.
So because it is a chronic condition, you're gonna have to sort of, adapt and adjust your lifestyle.
Yes.
You eat healthy, you make sure you are active physically, you keep checking with your doctor how you are doing, but most importantly, take your medication, take your Sinopol regularly to make sure you keep this under wraps, get your hormonal balance in action.
Thank you so much. Our last two questions, Catherine. Do I need a prescription for Sinopol?
The nice thing about Sinopol, remember we said it's a health supplement, meaning
Yes.
that it's Schedule Zero. You don't need a prescription from a doctor. You can just buy it. Also, in the pharma industry, we talk about something called an epi code. It's
Yes.
just a number that one can use with your medical aid to say, I'd like to claim for my Sinopol. So, yes, you can claim it as well.
That's great news. And then our last question is, where can I buy Sinopol?
I love this question because now you know this product, now you want to find it. You can go to brick and mortar, you can go to a pharmacy or Clicks or your Discount or independent pharmacies and ask for Sinopol. Or if you want to order online while you're shopping for everything else, Take a Lot. You can buy
Yes.
it from Take a Lot. It's so convenient. And you have an option. Either you buy the sachets, a pack of 30,
Yes.
or if you prepare a tablet, you can buy also a pack of tablets and you can have that. So it's really convenient and available.
Awesome. Thank you so much, Catherine. So I know with the Sinopol, I used to take the sachets. I also have PCOS. I used to take the sachets, but now they've got the convenient, like the blister packs. So
Yes.
it's much easier if you don't want to stir it and try to get everything down. But it's a very good
Yes.
product. So thank you very much for this. And thank you also taking the time to talk to us about PCOS, which is quite a big thing in South Africa. And like you said, we're doing this because there are so many women that don't even know they have PCOS. So
Yes.
even just if there's some of the symptoms that you think that you've heard Catherine discuss here, and you think you're dealing with, the acne, the weight gain, especially around the belly area and stuff, consult your doctor, go and see your gynae, and let him check if you do have PCOS. And it's not like a death sentence or anything. There is help in the form of Sinopol. It's one of the products that you can use. It can help you balance your hormones with this. So thank you. If you have any closing words, Catherine.
Oh man, we're all about making sure your quality of life improves. Go
Yes.
out there and have fun and make sure you've got your Sinopol in your handbag.
Awesome. Thank you very much. Thanks very much. Have
Thank
a
you.
great day further, and we hope to chat to you again soon. Thanks, Catherine.
Thank you.
Thanks.
Thank you so much for
Bye.
having me here again.
Thanks.
Bye-bye.
Bye.